Dental bridges are the most common method of replacing missing teeth as well as restoring smiles and bite. If you're missing teeth and want to get one, you must be aware of the steps to get one. In this short video, we'll outline how to go about making a dental bridge. 1. Dental consultation. The initial step for obtaining an implant-supported dental bridge is to set up a consult by a doctor. At this time, dentists will take a look at your mouth and teeth in order to assess if a dental bridge is the ideal option for you. They'll also talk about possible treatment options as well as answer any questions you ask. 2. The X-rays, impressions, and X-rays. If you're a dentist and you choose that a dental bridge is the right choice for you, the next step would be to collect X-rays and impressions from your mouth. This can help your dentist make a customized bridge that will fit the shape of your mouth and looks natural. These impressions are then transferred to a dental laboratory in which the bridge will be constructed. 3. Abutment tooth preparation. Prior to the bridge being able to be set, the abutment tooth, the teeth located on both sides of the space in which the missing tooth lies, have to be cleaned. This involves the removal of some of the enamel of these teeth to allow in which the bridge will be inserted. The dentist can numb the affected area using local anesthesia prior to the procedure. 4. Temporary bridge. As an actual bridge has been created in the dental lab, a temporary bridge can be installed to guard the teeth at the abutment and to improve the look that your smile has. The bridge that is temporary is generally composed of acrylic, but will not last as long as the permanent bridge. 5. Installation of the bridge permanent. After the permanent bridge is completed, go back to your dentist's office for it to be fitted. Your dentist will inspect the fitting and aesthetics of the bridge prior to putting it to the ground. They can make any adjustments needed so that the bridge fits comfortably and is natural looking. 6. Follow-up appointments. When the bridge has been put in place, it is possible to make appointments for follow-up visits with your dentist to confirm that the bridge functions well and maintained properly. Dental professionals can provide directions on how you can maintain your dental bridge in order to extend its lifespan. 7. The maintenance of the bridge. The proper maintenance of your bridge's dental health is vital to the long-term health of your bridge. It is essential to brush and floss on a regular basis to keep your bridge free of gum disease and plaque buildup. There may be a need to employ special instruments for floss, like floss threaders and interdental brush, to scrub the bridge and ensure it stays free of plaque and other debris. The final conclusion is that having a dental bridge requires various steps, from initial consultation until the placement of the bridge. Following the recommendations of your dentist and taking good care of the dental bridge, you'll be able to enjoy a new dental appearance and healthier dental health for many long time to follow. If you're thinking of the purchase of a dental bridge, ensure that you book an appointment with a dentist who will examine your options and decide which treatment is best to suit you. ND, the natural look of the solution for improving the look of your smile. Composite veneers are a more economical option that is installed in just one visit. Laminate veneers can be a great choice for people who want a less bulky and more transparent veneer. The removable veneer is an aesthetic dentistry choice that is easy to apply or removed. They require no preparation, is a much less impactful option for people with good dental health. Dental veneers offer the most versatile and efficient dental cosmetic solution for people who want to boost the appearance of their teeth.